Hello, everyone. I'm Jennifer Nuzzo, Director of the Pandemic Center here at Brown University School of Public Health, and I'm very pleased to welcome you to today's discussion, which will be focused on health systems resilience during COVID-19 and cross-country lessons for future public health emergencies. The COVID-19 pandemic has made, unfortunately, quite obvious both the critical importance of and the fragility of our health systems. Over the past 3 years, we've witnessed how surges of infectious patients can overwhelm health facilities around the world. This has caused staggering health tolls. To date, more than 7 million deaths reported worldwide, and millions are also suffering from lingering symptoms of their infections that in many instances have been debilitating and disabling. And we know that these are just the direct health impacts of the pandemic. We also now know that the harms caused by COVID-19 have been multifold. Across the globe, many countries are now reporting historic declines in life expectancy, in part due to the loss of life from COVID, but also as a result of the disruption that the pandemic has caused to health systems. These interruptions to routine, therapeutic, and preventative services have caused significant erosion and gains in many other priority public health areas. And so the effects of pandemic-related disruptions to health systems will be felt for years and years to come. So for today's discussion, we not only want to take stock of what we've learned about COVID-19's impact on health systems, but also what we've learned about what it will take to ensure that health systems are more resilient in the face of future public health emergencies like pandemics. As the COVID-19 emergency declarations are waning across the globe, we heard it last week from the World Health Organization, and now many national governments are also sort of rescinding their declarations of emergencies. We think it's important that we focus on possible solutions. What can we do next time to prevent these harms from happening again? And despite the unprecedented challenges posed by the pandemic, some countries have employed innovative strategies that did allow their health systems to be more resilient in the face of COVID-19 than others. So here at Brown University, the Pandemic Center, we've had the fortune of being able to collaborate with a number of experts and well-regarded organizations that have been working in this space of health systems resilience, and in particular, trying to identify what practices countries put into place in response to COVID-19, and to try to identify lessons learned and sort of best practices that will allow us to think about how to equip our health systems to be more resilient, not just to meet the acute needs of public health emergencies, but also the full set of needs of populations. We have been fortunate here to be collaborating with these partners through our work, which has been conducted as part of the Exemplars in Global Health program. And for those who may not know, the Exemplars in Global Health program is an initiative run by Gates Ventures that brings together partners from around the world with the mission of identifying positive global health outliers, analyzing what makes countries successful, and disseminating the core lessons so that they can be replicated in comparable settings. And so in doing so, by studying these lessons of what worked, we're hoping to equip country-level decision makers and other global partners to make decisions about improving their plans for the future, allocate resources, craft evidence-based policies. So our recent work with the EGH program allowed us to identify best practices, strategies, and lessons learned for maintaining the delivery of essential health services while also responding to COVID-19. And specifically, we looked in 6 countries in Asia, Sub-Saharan Africa, and Latin America. We did this work in partnership with Johns Hopkins and Makerere University and with research partner organizations in each of the 6 exemplar countries. So this was really locally led research, which was really critically important for surfacing insights and contextual information from each country, and also for making sure there was a connection to the decision making in each of those countries so that the lessons learned could be taken up and shared more broadly. So what we want to use this webinar to do is to discuss some of what we have learned throughout this project. We are fortunately joined by some of our co-collaborators, as well as individuals who have helped guide our work. They also are doing similar and important work in this space. And so we're going to have a broader conversation. We're going to talk about what we've learned as part of our exemplars in global health research, as well as what our partners have learned in their own work in this area. And the goal here is really to focus on solutions and to look forward about what we can do better next time. So with that as background, I am quite honored to be able to introduce our panelists today. On the Brown side, we're joined by Moyatri Guha, who is the Assistant Director of Dean's Special Projects and the Project Director of the Center for Health System Sustainability here at Brown. Moyatri helped lead the EGH work on the Brown team, including the analysis of cross-cutting themes and lessons observed from each of the 6 countries in Latin America, Africa, and Asia. I'm also joined by Dr. Rhoda Wanyenze, who is Professor and Dean of Makerere University School of Public Health in Uganda. Professor Wanyenze has had extensive experience in public health research, capacity building, and program management in the space of infectious disease, sexual and reproductive health, and health systems. For the purpose of this conversation, Dean Wanyenze's team led the EGH work for the African continent and helped contribute to the cross-country thematic analysis. And then I'm joined by 2 advisors to us on this project, Dr. Gina Saman, who is an infectious disease epidemiologist who has spent her career focusing on pandemic risk management. She's with the World Health Organization and leads a global initiative to strengthen preparedness and resilience for future infectious disease threats. I'm also joined by Dr. Silzan Bali, who's a health specialist with the World Bank. She's based in Washington, D.C., and she's part of the Health, Nutrition, and Population Unit and on the Global Engagement Team. She provides technical support to the bank's regional and country teams on pandemic preparedness response, One Health, and health systems resilience. She helped author the World Bank's flagship report, Change Cannot Wait, which if you're interested in this space, I highly recommend reading. I'm sure many of you already have, but really has worked for the bank on a number of important initiatives related to resilience, health systems, and public health capacity building. So the structure of this webinar will be a conversation. We will have a Q&A towards the end, and I encourage participants who want to ask questions to use the Q&A function on Zoom. And I will be looking at those in order to pose questions to the panelists. But I will first get the conversation started by turning to each of our panelists and asking them to reflect a bit on their work most recently in the context of COVID and health systems resilience. So maybe first I'll start with you, Moyatri. So you led the work here on the Brown team, working with the in-country research partners in Asia and Latin America, but you also got an opportunity to look at the findings from each of the 6 countries and to kind of identify what we saw in common among each of those 6 countries. I realized that there was a lot to learn in all of those countries, but maybe if you could just reflect on some of the kind of highest level findings and, what do you think were some of the most compelling findings of that research that you want to share to kind of highlight the analyses that we are publishing to come.
Thank you, Jennifer. Sure, happy to. And good afternoon, good evening, good morning to everyone. So as Jennifer mentioned, we did this cross-country synthesis on 6 exemplar countries that were part of the Exemplars in COVID-19 research project. The 6 countries are Thailand, Sri Lanka, Dominican Republic, Costa Rica, Uganda, and Ghana. And each of the countries did a deep dive mixed methods approach, looking at kind of doing a literature and policy review, key informant interviews, as well as qualitative and quantitative analysis across various COVID and essential health service indicators. Then we really took a deep dive in their final reports to synthesize the key findings and identify some cross-cutting themes and best practices for maintaining essential health services during COVID-19. So a couple I will highlight, and there was a lot, so it'll be a subset, but I'll highlight a few that actually were quite common. They were common across about 4 to 6 of the countries. So it increases our confidence in terms of its generalizability across settings. So the first one I'll highlight is the importance of a coordinated whole of government response with strong multi-sectoral collaboration and decision-making involving both health and non-health agencies. Several of the countries talked about the importance of this. They had early establishment of multi-sectoral national decision-making bodies that were really championed by the highest levels of government. And this really facilitated swift action and policy decisions in several of the countries. In terms of partnerships, it was, both health and non-health agencies within government, but also many of them had scientific advisory boards. So really strengthening that academia and government partnerships to make sure that decisions were made based on data and evidence. And I'm happy to give more country examples later if we have time, but one I do want to highlight here is Thailand, who's really been recognized for kind of their longstanding investments in health system strengthening and preparedness, as well as having excellent health leadership. So they had a centralized cross-ministerial leadership body and command center that was chaired by the Prime Minister. Uganda as well, which Professor Rhoda can talk more about, had a multi-sectoral national task force that was established very early on and chaired by the president in Uganda. And both of these countries very early on activated their multi-sectoral emergency operations center as early as January 2020 to really enable the high-level decision-making. The second theme I'll highlight is all 6 countries highlighted the importance of strong partnerships with the private sector. So this really enabled and helped facilitate procurement of PPE and other resources, scale up of testing and vaccinations, case management, as well as provision of essential health services. There are several examples of this. Many countries collaborated with their private sector laboratories to make sure that testing capacities were expanded quickly. Several of the government partnered with non-health venues such as malls, sports stadiums, hotels to set up vaccination sites as well as quarantine centers. And Dominican Republic, the government partnered with private companies to help finance vaccine purchases, manage storage and transport of vaccines, as well as provide physical space for vaccination centers. The third theme I'll highlight is various service delivery adaptations and provision of care through alternative modalities, which were necessary in all countries, given the disruptions to essential health services. So this included making sure that there were dedicated facilities for COVID care, and various digital health innovations that we saw in all 6 countries. So of course, the use of telemedicine, teleconsultations, but also Ghana had a great an innovation around using drone technology to expand testing and vaccine coverage, specifically in the more remote areas of the country. There was also home delivery of medications and multi-month drug dispensing in many of these countries. The fourth cross-cutting theme was the rapid mobilization and deployment of health workforce for COVID response, as well as essential health service delivery. Multiple countries were able to hire health workers rapidly, as well as redeploy existing workforce in high burden communities and hospitals. And actually, many of them had pre-event integrated health systems that really helped with understanding, how swiftly they could move healthcare workers, patients, supplies across the different levels of the health system, which really helped with kind of having the operational flexibility at a time of crisis. And task shifting and reassigning of roles and responsibilities were also seen in multiple countries. The next theme was kind of along those same lines, that flexibility to move patients' resources across different healthcare facilities, depending on shifting demand and capacity. And one country I will highlight is Costa Rica here. And they've had kind of decades of investment in making sure that their health system is both vertically and horizontally integrated. And the One Caja initiative, which was the integrated strategy management network that really helped with making sure that no one hospital was overwhelmed, and there was sufficient kind of personnel and resources to allocate both towards COVID care as well as essential health services. And I will see, there's a lot more, but I will finally end with, I would say 2 more, like flexible health financing mechanisms in all of the countries to support both emergency response as well as maintenance of essential health services. Many of the countries already had universal health coverage, so really being able to expand that to ensure people had access to COVID and non-COVID care. Costa Rica had this contingency fund that they were able to use to really expand hospital capacity and obtain PPE and other resources. And finally, adaptation of existing disease response capacities and infrastructure. So many of our countries had experience fighting previous pandemics, epidemics, such as SARS, Ebola, HIV. So really being able to use what was built during that time, such as rapid response teams, surveillance systems, and coordination structures to strengthen their response to COVID-19.
That's great. Thanks for giving us a taste. I realize the findings are many, which is great. I mean, it really surfaces a lot of options for other countries to consider. I'm going to turn actually to Dean Nwanyenze. Dean Nwanyenze, you led the overarching research and that kind of coordinated the work of the in-country research partners for the African continent. And you got to, observe lessons from the 2 countries, Uganda and Ghana. I recognize that you're doing this research, looking at the response in these countries to COVID-19, but also then, not long after and possibly overlapping, Uganda experienced an Ebola outbreak, following the, kind of pressures of COVID-19. So just wanted to pose to you, from your perspective, what were some of the most salient takeaways from the research, and what should we be, thinking about for the future in terms of, what we've learned from previous experiences, as well as, prior investments following some of these events?
Thanks, Jennifer. So based on our experiences building on the summary of the cross-cutting findings, I would say that in terms of health systems resilience, building on the structures that we had previously, for example, the national level multi-sectoral platform was very useful for us because it's a structure that we've used for decades, for example, in Uganda and all the other countries that we studied in Africa. And it can be used to bring up any emerging challenges and resolve them. So for example, immediately we detected we had issues with disruption of services. This platform was used and we started exploring interventions across all the sectors to ensure that even while the restrictions continue, we are able to maintain services. So this was really very useful, but also the weekly national task force meetings convened by the Ministry of Health for all the other outbreaks before and also for COVID was very useful. We quickly integrated, for example, in Uganda, indicators for tracking sudden services, disruptions. And when this was detected for a few, starting with HIV and TB, for example, then a separate standalone committee was set up for maintenance of essential health services, which then quickly developed guidelines and disseminated them and mobilized partners to support health workers, train and do the supervision and make sure that we maintain services. So for example, because of this, we noted that the recovery in the disruptions in Uganda was much faster than we noted in the other countries that we studied because of this quick intervention. So this platform that existed was really important. But the other issue that I need to note is the investments in the health information systems, including the DHIS2 that's electronic, and the investments in improving data quality. That was really useful because then we had data that was readily available to analyze and detect disruptions in services. And again, we used the same platforms across the other countries where we worked to be able to detect the disruptions. Although this data was perhaps better for some disease conditions than others that have not had as much investments. Then the other issue I could probably emphasize that's cutting across many of the countries is the community health systems. These have different names across countries. Community health workers or village health teams, and across all these countries, these were really useful. For those that had a lot of outbreaks and had already trained them, for example, we saw in DRC, they had already been activated. In Uganda, we had already trained more than 10,000 in preparedness for the Ebola response. And so these were really useful, quickly deployed to be able to support both surveillance and response to the pandemic, as well as maintenance of essential health services, delivering services within the community and within the homes that were safer. And this was the case in Ghana, in Uganda, and in the other countries as well. And then we see also across these countries investments in training epidemiologists, field epidemiology programs that are supported by CDC, especially in many of these countries. These were deployed to support surveillance systems, as well as supporting analytics to improve the tracking of services across the countries. In terms of the lessons that we pick, I would say that a lot happened around this response. Challenges, for example, we see data was very useful, but at the same time, we noticed that in some programs, data was not good at all. And at some point, there were delays in entering data. So I think we need to do more in terms of investing in data across the board so that we can be able to have good quality data, but also have capacities for analyzing the data to support tracking of services, as well as disease outbreaks. Then we see also that some conditions and indicators were tracked while others were not. And it's possible that we left some of these behind and we are not able to detect the disruptions. So I think it's really important that we have more guidance on what should be tracked when we have these challenges. And then we have really good platforms like the community systems that are very useful, but we haven't yet fully institutionalized them and resourced them sufficiently. So I think in terms of lessons, we need to do more around that. And then also perhaps paying attention to equity issues. So we can see issues around the national level, subnational level, when we eventually detected that there were variances across the districts and the regions. But at the same time, we don't know what was happening to the most vulnerable groups that had more challenges, perhaps with transportation and other issues. So we need to do more, perhaps, around that, while at the same time investing in documenting the good practices and innovations, which were many, whether it was the digital health or whether it was using the drones, and there were systems for tracking patients at community level, both digital and using community systems, and also the differentiated service delivery models. So perhaps we need to invest more in deliberately documenting these and identifying opportunities to scale these up, even beyond circumstances of outbreaks. Yeah, thanks.
Thank you. Those are really important insights. Maybe turn to Dr. Saman. Gina, thank you, first of all, for serving as one of our technical advisors for this project. Your guidance was really, really important. So you have seen the evolution of this project and the learnings of it, but you are also working on your own to advance, make advancements in this area. And I know that WHO recently launched the PRET initiative last month that is related to this. And I'm wondering if you could tell us a bit about that initiative. What is it? First of all, congratulations on launching it. But tell us a bit about what it is and how it relates to this topic, and if we can kind of pull some of the findings from this work into that initiative.
Thank you so much, Jennifer, and greetings, colleagues. A huge thanks to the Pandemic Center for convening this meeting, this webinar. I think it's wonderful to reflect on the lessons learned, the outcomes of the research done in the variety of exemplar countries, and they are truly exemplar. I think two things to highlight are that the Exemplars program is outstanding in its ability to conduct the work in real time, to focus on operational research that's needed, that's cross-cutting, as we heard from Professor Roda just now, as well as linking to decision-making and informing policies, again, in real time. So really a chapeau to the teams that did this work and for the convening role that you all played in it. So, PRET, what is PRET? We say, are you PRET for the next pandemic? PRET, of course, meaning in French, ready. And so this is what we're focusing on. We're taking the lessons learned from COVID, we're taking the lessons learned from previous epidemics and pandemics and saying, what next? Pre-COVID, 92 countries had pandemic preparedness plans, say for influenza. During COVID, 177 developed preparedness and response plans for COVID. So what next? And what do we do in terms of these lessons learned, in terms of the innovations, in terms of the increasing complexity of needs, stakeholders, community interactions, what next? And this is what this initiative, Preparedness and Resilience for Emerging Threats, PRET, does. Launched 2 weeks ago, it takes a new, fresh approach to pandemic planning. It basically applies a mode of transmission lens to preparedness for future pandemics. A mode of transmission, the first piece we're focusing on is respiratory mode of transmission, and saying for this group of pathogens that transmit according to the respiratory mode, what do we need to do to get ready for them? There's a sweet spot there between what we do generically in terms of systems and strengthening the basic core capacities that we need, and the very hazard-specific needs as well. There's a in-between here. And the reason is, like COVID, SARS-CoV-2 came, really it was a pathogen X for us. And so we need to be ready to leverage the basic cross-cutting systems, as well as the disease-specific systems, and find a way that we can be agile and nimble in it. So to answer your question, what do we learn? What did we take from the exemplars? I think all of the above has informed the development and the forward thinking of what countries should be thinking about in terms of updating their pandemic plans and strengthening their preparedness. A great example is the Costa Rica example with having flexible financing. That's a great example of what needs to be done to be ready next time, to be PRET next time. You need to be able to have mechanisms that are dynamic to address needs as they arise. We heard about data and integration of data from all 6 countries that participated in the exemplars. So say here's another example of the data connectivity, genomics. Pre-COVID, we really didn't track how many countries had routine genomic sequencing, genomic surveillance for pathogens, high-threat pathogens. COVID came along, early 2021, about 103 countries had in-country sequencing capacity. By the end of 2022, in a span of 2 years, that went up to the majority of countries, 163. And so you can now say, well, there's this whole new world of data, of sequence data. How does it relate to other data that's collected from the environment, from human and animal hosts? How do we put this together, the integration needed, the metadata, the information around the sequence that's gathered? So here's another space, and what we do in PRET is to say, okay, well, you've got the respiratory group. We need to think about what we do with that data integration to be ready in our respiratory specific systems, to be ready to be better prepared for the next one. So I think the key message we're saying now is, look at what you've done during COVID, look at your lessons learned, and thinking ahead, what are the few things that will tangibly make your next response to the next pandemic better? And this is what PRET tries to guide you to do.
Thank you so much for that. I really appreciate the emphasis on trying to make sure we don't forget what we've learned and to carry that forward to improve the preparedness plans going for the future. I'm going to turn now to Suzanne Bali. Dr. Bali, can you talk to us? You were part of the team and really led the World Bank's flagship report on health systems resilience. So you've taken a very broad look at these issues too, in addition to being a member of our technical advisory group. Thank you so much for your insights on that. What, from your perspective, have we learned about how countries should prioritize health investments and try to really operationalize health systems resilience? I want to make sure, in the spirit of what Gina said about sort of learning from COVID and carrying that forward, what should we be focusing on?
Thank you so much, Jennifer. And first of all, thank you so much for inviting me for this, to you and to the Pandemic Center for this excellent session. And also thanks to you for being part of the technical advisory group for the report, Change Cannot Wait. And we at the bank really benefited actually from some of the insights that have been collected as part of the Exemplars in Global Health program. So just to answer your question, on what are the key areas countries should really prioritize to strengthen resilience. So first thing that I would definitely like to mention here is really looking at the lessons learned, right? Looking at what have we learned from the crisis, doing your intra-action and your after-action reviews, your simulation exercises, because a core part of resilience is being able to really learn those lessons and to be able to transform them. And we've seen countries that have had experience, epidemics or frequent outbreaks in the past and have incorporated those lessons are able to do better. And Dr. Rhoda, I know you've done, for example, a lot of work in Uganda, and that really comes to mind when I think of that as a country that has dealt with smaller outbreaks and it's able to control them and continues to learn, right? So that's one example. In other aspects, in terms of, I know Moitri covered a couple of things as did other colleagues, Dr. Saman, you mentioned. So let me just mention some very quick points. Number one of the big lessons we learned was the importance of governance in terms of how it impacts trajectory of a crisis, right? How countries respond. And that includes everything from leadership and who is leading, who's making the decisions. It includes how is the decision being made? Is it evidence-based? It includes how strong are your public health institutions? And that is a very important lesson. So one of the big areas that countries can really prioritize through targeted investments in stronger public health institutions, in making sure your decision-making processes are evidence-based, making sure there is command structure in place. You have EOCs in place that can help coordinate and lead response in times of crisis is critical. Second, really talking about and again, looking into partnerships. And I cannot say this better as Moitri put it really well, really the importance of your multi-sectoral platforms, right? And I think other panelists also, Dr. Rhoda, you talked about the importance of multi-sectoral platforms as well. That becomes very critical. Your regional partnerships. Countries should really invest into looking beyond just the country, right? Sometimes you can really benefit from economies of scale that can come with regional partnerships, making sure we're partnering with private sector. And again, several examples are there, happy to talk about them if needed, but that's the second part. Third, really human resources, really expanding your community health workforce, making sure you're building your multidisciplinary frontline competencies for PPR, and not just in field epidemiologists, your frontline workers, your nurses, your community health workers, making sure they have the in-service training that is able to, even small things like how a sample is collected, how to do contact tracing. That made a huge impact. And so really investing in your human resources and making sure you're building capacity at the frontline level. Your early warning, fourthly, the early warning system, the epidemic intelligence part, your community-based surveillance, point of entry surveillance, making sure you're leveraging a One Health approach towards, so going beyond sectors to prevent the outbreak from even spilling over into, humans. Having that sentinel surveillance in place is critical. And then, the last 2 points I'd like to mention, Jennifer, is really the importance of your service delivery. And again, how ready are your health facilities to deal with the shock? Are they able to, are they monitoring how, what services are getting disrupted? Because a core part of health system resilience is that your essential health services also should not be disrupted, right? So really making sure that there is monitoring of your service provision, making sure your health facilities are ready, there are continuity plans in place, right? All of those things make a huge difference. So that's another place where countries can invest. And last but not the least, really, amongst the gamut of areas that countries can really prioritize, and going back to a point that I think, Dr. Rhoda, you mentioned, really the importance of communities, really focusing on community engagement, your two-way communication, at times of crisis and even before crisis, to build trust in, interventions at time of crisis. You need that. So making sure there is engagement happening with the communities, they're involved in decision-making, there is engagement with your, influencers, your local leaders, and at the same time, there is making sure that we're listening. There is dynamic listening happening in terms of the attitude and knowledge. So investment in those areas can really strengthen resilience. Let me stop here.
Thank you so much, Sultan. And I'm actually really glad that you ended on that community piece, because for me, sort of observing some of the great challenges of the pandemic was around that piece. They kind of enlisting the public as part of the solution and not necessarily the thing that was having things done to it. I'd like to take some questions and answers. So encourage folks to put questions that they have in the chat. In the meantime, I'd like to just pose kind of a higher level question to you all. I mentioned at the beginning, we are now seeing governments, WHO downgraded the public health emergency for COVID. Many governments are following suit. I think many are doing so with the notion that the pandemic and the challenges are behind us, that we probably have some, good period of time to not have to worry about these things. First of all, what would you say to countries in terms of thinking about health systems resilience today, as we are sort of out of the emergency period, if you can truly say that? And what would your advice be in terms of the kind of highest priority areas that they can attend to now for thinking about future pandemics? I want to kind of focus on the need, addressing that many countries may not be perceiving the need anymore, and how we can kind of put health systems resilience in the context of those sort of questions and concerns that countries may have. So I'm going to open it up to each of you. Perhaps Gina, your camera came on, so maybe you could go first.
I'll start before I forget my point, Jennifer. So the key one really is, and as you say, focusing on the needs and avoiding this cycle of panic and neglect. I think the key issue, and it's recommended in our guidance through this PRET initiative, is to focus on what are your routine systems? What do you use every day for seasonal epidemics, for the management of routine events, for your surveillance systems that track and monitor over time, and to look at them and say, where can I strengthen some of that? The routine systems that are used on a day-to-day basis, because there is no alternative system really come an emergency. You're going to have to either bolster or adjust at the time of an emergency. So we really are encouraging focusing on the routine. So a great example is for respiratory pathogen preparedness. We're saying, well, we've got these wonderful systems such as the Global Influenza Surveillance and Response System, which was used for surveillance of SARS-CoV-2. What can we do there? And so now the concept is, well, AEGISTERS Plus, can we look at a broader spectrum of respiratory viruses to be part of the surveillance system? In clinical care management as well, the pathway that was used as an assessment for the pathways for patients to respond to COVID, we're now saying, well, build on that system and think about it in a respiratory all-encompassing way. So it's strengthening the routine, because the routine is what you use and is the foundation of the future. Thank you.
Great. Let's see who wants to go next. Maybe Dr. Rhoda, do you want to go?
Yeah, thanks, Jennifer. Building on to what Gina has just said, I would actually say that on the ground for us, we moved on before the announcements. I just get the sense that we had already moved, and we moved because of need, as Gina said. So we have so many competing priorities. If I could use our own example in Uganda, so we've gone through outbreaks of anthrax twice during COVID. We've moved on to Ebola, and then we still have to take care of so many other infectious diseases, the needs of mothers and children. So we had moved on based on our needs, and we had already started the processes of beginning to think through what will the integration of COVID look like into other services, whether it's surveillance, whether it's the testing, whether it's the vaccination, what is it going to look like? And we've been going through these debates for perhaps almost a year and trying to work out some strategies of how we move forward. But we still need to do some more work around what this integration is going to look like for COVID, but also for the other services. When we bring this together, are we better off or otherwise? And one of the other issues thinking through, we have lots of lessons, and we always do have a lot of lessons from after action reviews, but does our system get any better? Is it learning, and what does that actually look like based on what we have gone through? I think that's really important for us to continue to look at, but also thinking through a lot of the disruptions that we've had to other sectors beyond health. We've studied the health sector disruptions more than we've studied what it's done to education, the social systems, and all the other services. And these are the determinants of health. What does health and health outcomes actually look like post-COVID, even after this announcement? How long does it take for us to get back on course? And how is this going to affect health and development in a broader sense? So I think we still have a lot of work that we need to do. And I hope we don't forget too soon and move on completely. Thanks.
I share your hope too, and thank you for highlighting the kind of broader impacts of this pandemic. I think it's really important for us to think about when we prioritize investments, that it's not just these one constrained set of variables, but broader societal impacts. Susan, what are your thoughts on this?
Thank you so much, Jennifer. I think just 3 points that I'd like to mention here. I think number one, we're already thankfully moving away just from looking at capacity. We're looking at risks, right? So when we're talking about epidemics, we need to see risks and capacity together. I think that's really one way. What is the country most vulnerable to? What kind of risks? You know, is it epidemic risks? Is it other risks? Like, is it natural disasters? Because then that needs to be taken into account into planning. Secondly, really, I think the central piece has to be the primary healthcare. You know, for too long, we have really been in silos where PPR is separate and, you know, considered completely separate investments. Indeed, you have disease-specific investments, and then you have, you know, primary healthcare. Really the central piece of delivering all of different services, whether it's PPR, whether it's NCD, at the end of the day is PHC. So that's what we really need to strengthen. We need to strengthen the foundations. We need to make sure that the PPR investments are happening at the PHC level. We're training our doctors and nurses. We're training our community health workers. We're making sure our health facilities are there, right? You know, they're prepared. And at the same time, they're able to provide those services, that sample referral process, that patient referral process is there, and making sure it's our data, our lab data is integrated with the data that is being collected at the facility level. So really the foundation is, I think, a really, really key part of it. So that's just something I really want to stress on. Let me stop here.
Excellent. I'm going to turn to Maitri, and then we'll take some of the questions in the chat.
Thanks, Jennifer. I was going to second that point Sulzan mentioned about really investing in strengthening primary health systems, which is something we saw in many of the exemplar countries. And again, these are decade-long investments that countries have made in really building their primary health capacities, their health workforce. So not starting when the next crisis hits, but starting now, applying the lessons learned. And then I'll go back to kind of something that came up that many of us mentioned, but really thinking about that building out multi-sectoral platforms for engagement and decision-making. And this is with, you know, health and non-health agencies, the private sector, civil society, We've seen this time and time again that it's been absolutely critical, and the health sector alone cannot build resilient health systems. We must engage the non-health sectors, and I think we'll make a more successful case in the long run if we do. And investing in health information and data systems. I think that's, while these are exemplar countries, one challenge that was cross-cutting was certainly data, real-time quality, availability of data, which we've also seen in high-income countries, which was a challenge. And then finally, building regional and local manufacturing and supply chain capacities, which I know I'm probably preaching to the choir here, but obviously has been difficult with kind of global vaccine equity and conversations and so forth. So,
you know, I'm struck by in everything that you all have said, how many of these sort of lessons and approaches are really threat agnostic. You know, they are you know, capacities and approaches that you would tap for a range of different scenarios, whether it be the next pandemic, a respiratory pathogen, a smaller outbreak, or even a natural hazard. And, you know, I think, Suzanne, to your point about considering the risks as perhaps the motivator for thinking about these issues, I think is really key. But also it really strikes me about how durable and reusable some of these approaches are. That I think is an important, hopefully, motivator for countries, that it's not just, you know, an break glass in case of emergency approach that you hopefully never use. Chances are there will be multiple opportunities to use these sorts of approaches. We've got some great questions showing up in the Q&A. And maybe to make sure we get to them, I'll just kind of go through them, and whoever wants to take it can, and maybe we'll try one person to answer unless someone has a burning salient add-on. I'm going to just go down the list here. So the first one is, how does the research advise us as we toggle from pandemic to endemic, the new, quote, normal? Who wants to take that question? Dr. Rhoda, perhaps, or anybody who wants to take that one?
Well, I think what it really teaches us is to have strong systems, and I think we need to continue to learn. From the pandemic, we can learn, we have a sense of what that strength means and what we need to have in place, whether it's workforce, different cadres, whether it's data, whether it's, and we learn that when we have these prepared and strong, they will work for us for anything. It will work for COVID, it will work for TB, it will work for HIV or whatever other conditions that we are dealing with. So for me, I think this is really important, but especially the multi-sectoral component, thinking about it, whether it's in form of the decisions that go across sectors, resource allocation, whether it's also thinking about it in the broader sense of the health determinants. I think that is something that I hope we can maintain, whether we are dealing with TB or whatever other condition. Yeah.
Because you mentioned TB, the next question actually pertains to TB, and I'll let whoever would like to respond to it. It says, despite TB programs having been core to the COVID-19 response in many LMICs due to their respiratory competencies and infrastructures, we are seeing national TB programs being far removed from national conversations on PPR/resilience planning. How can we bust those silos sustainably? Yeah, great question. Who'd like to take that? Suzanne?
I can try.
Maybe Gina,
Jennifer.
Yeah. Go ahead.
So just I do think that's a really great question, and I think it really touches upon one point that is a challenge we all know that we faced, is fragmentation. And I think it's a great point that during COVID-19, a lot of TB and HIV machines were used for COVID-19 testing. And now, as the person who's asked the question has said, this is far removed. How do we address that? One way to address that is really, number one, making sure there is joint planning happening. Number two, making sure really the planning is happening with all partners, with all stakeholders in mind, that is led by the country. So I think that becomes really critical, because when all of this joint planning comes into place, who has resources that can be capitalized, right? What are the complementary investments that are there that can strengthen resilience, that can strengthen PPR, and at the same time have benefits outside towards, disease-specific outcomes as well. So that's really one suggestion that I would say, as countries move, beyond COVID and start looking at long-term planning, making sure all the right stakeholders are on the table, and that planning process is really, truly in partnership, but led by the country.
Great. Thank you. Let's see. There are a couple questions here about supply chain, which I know, Moitri, you brought up supply chain issues, preparing, how do we deal with the supply chain challenges, and then also talking about the inequity issue. Maybe I'll kind of combine all of those, plus the last question about sort of these siloed approaches, and maybe Gina and Moitri, if you'd like to kind of take any piece of those and respond.
Just building on what Sulzan mentioned, and in terms of these siloed approaches, I think that health system resilience lens, at least for me, has been very helpful in these conversations where we're not just talking about the next infectious disease outbreak. Building resilient health systems will help with dealing with impacts of climate change, will help with these rising chronic disease burdens we're seeing, mass migration, urbanization. So I think that kind of multidisciplinary lens has been useful, and kind of really keeping your audience in mind and targeting accordingly. But that kind of helps us get away from the siloed approaches that unfortunately we've seen in the past in global health. Just to answer briefly on supply chain. So yes, it was a challenge in a couple of the countries. So I will say, so Thailand had some delays in vaccine procurement, whereas Dominican Republic actually did well because of their partnerships with various international organizations. So going back to the need for this, for global coordination, collaboration, solidarity around really helping countries equitably get access to vaccines and other resources. And I know probably Professor Rhoda can speak to this a lot better, but there are various initiatives underway to build regional capacity for vaccines and other supplies in many parts of Africa now, which is great to see.
Great. Gina, anything you'd like to add to those?
Sure, thank you, Jennifer. And great questions, actually. Even touching back on the TB one, I actually do question the premise of this one slightly, because I think we are seeing in some spaces the breaking down of silos. The one that comes to mind immediately is again on genomic surveillance, where countries are saying, well, I don't need a sequencing capability specific for TB. I don't need it specific for the respiratory pathogens. I don't need it specifically for dengue and the arboviruses. I need one centralized facility that can serve all needs. Egypt is a great example of this, building a centralized sequencing facility. And the programs at the global, regional, and country level are coming together and saying, right, TB, you're in the game as much as we are. What can we do together? So I think there are some outliers there, and maybe these are areas for future research to say, well, where are the silos being broken down? On other aspects, especially supply chains, something that came to my mind is, if you look at the 2009 pandemic, where there were also supply chain issues around vaccine availability, countries that had seasonal influenza vaccination programs were able to receive stocks of vaccine earlier than those that didn't have seasonal programs. And some of it is that operational readiness to receive. So key aspects of having national deployment and vaccination plans, addressing the gaps there, including down to waste management, were interesting. But as Moitri, you were saying, the idea of the pandemic is now unleashing a whole set of new initiatives around building and bolstering capacity in different regions and different countries, building in a sustainability mindset around that, so that it's not just used at the time of emergency, but how do we use these facilities in the routine context and sense? The supply chains are being bolstered at the global level as well. So I think there is a lot going on And definitely, again, I call for more research to keep our finger on the pulse on this and keep us accountable on it. Thanks.
Great, thank you. I really echo your call for more research. There is clearly more work that we need to do, but at the same time, I'm also really struck by the kind of optimism in this conversation that we've really surfaced doable approaches because they were done. And so we know that they're feasible, but also that these are approaches that are not threat specific. These are not, building to the last crisis. They're sort of building to the future and equipping our countries and our health systems in countries for readiness for a range of likely stresses, as well as the day-to-day needs. And that's challenging often in public health, but I think we've really identified a number of really doable approaches to building sort of more durable preparedness. So that for me is quite uplifting in talking about the pandemic, which has otherwise not been an uplifting topic. I think we've really identified some important, feasible paths forward. So thank you all for that, for contributing to this conversation and for your time today and sort of sharing what you've learned in your own work. I want to wrap up by offering just thanks to you all for participating. Thanks to everyone who tuned into this webinar, and thanks to everyone who will share this recording once it comes out. I'd also like to thank our partners and funders at Exemplars Global Health, Gates Ventures, and the Rockefeller Foundation, our research partners at Johns Hopkins, McCary University, and in-country research partners in each of the 6 countries. We will send out information about all of that after this event. So for more information on our project with the Exemplars in Global Health, please access the website, which should be displayed on the screen at some point. Maybe it's happening now. We will be posting on the Exemplars website, there will be detailed country narratives, so deep dives on each of the countries. As Moitri was trying to go through the high-level findings, it's very hard to kind of convey all of them. Please do check out the work that each of the in-country research partners managed to surface on each of the countries. We are also going to be publishing research from each country and the cross-country synthesis in a upcoming supplementary issue to BMJ Global Health. So please look forward to that. We'll be sure to share it with everyone who signed up today. As always, we're going to be sharing the recording of this webinar. Please do share it and follow the Pandemic Center on Twitter and LinkedIn to learn about this event and future ones. And finally, I'd like to thank and need to thank my Pandemic Center colleagues who helped make these webinars a reality. Bentley Holt, Leah Levgren, Aquiel Person, and Andrea Ulig, Megan Calvo. We couldn't pull off these webinars without you, so thank you all very much. And thanks to all the participants and for everyone who is energized and ready to take forth these lessons and to work to build a world that's more resilient to these threats. So thank you so much.